welcome to Try Right. This is Part 365 and myself Srisha. So today in this session you are going to learn about Chapter 21 ICD-10-CM coding guidelines. So in this session you are going to learn about the follow-up guidelines, donor guidelines, counseling guidelines as well as encounter codes and their guidelines. So follow-up. So what are follow-up Z codes? So follow-up Z codes, they are used when a patient comes back only to check whether a previous disease or a condition has returned. So this means the treatment is completed, the condition is no longer present and the visit is for monitoring or surveillance only. Example in simple words is treatment is over and doctor is just checking if everything is still okay. So follow-up versus aftercare. So what is follow-up? Condition is fully treated. So what is aftercare? Condition is still healing. And there is no active disease in follow-up. There is a healing or recovery ongoing after the care. And follow-up is used for monitoring, whereas aftercare, it is used for recovery care. And the codes Z08 and Z09 are for follow-up care codes, whereas Z42 to Z51, these are the aftercare codes. So now what are the coding rules for follow-up? So you should not confuse with injury subsequent encounter. So injury, 7th character D is healing is still happening, whereas follow-up Z code is healing is finished. So this can be used with history codes. That is follow-up codes, they can also be used with history codes. So they often work together with history codes. So what is the sequencing rule? Follow-up Z code is sequenced first, whereas history code is assigned next to the follow-up Z code. So if disease comes back, so you should not use follow-up code. You have to use the active diagnosis code. Example, if cancer returns, so you have to code the cancer but not Z08 category code. And what are the types of follow-up Z codes? So Z08, the follow-up after treatment for malignant neoplasm. So the Z08 code, it is used when cancer treatment is completed, when patient comes for routine checkup, when there are no signs of cancer currently. An example is follow-up visit after a chemotherapy completion, and this is commonly used with Z85 category, personal history of malignant neoplasm. Whereas Z09 code is used for follow-up examination after the treatment for non-malignant conditions. So this is used when treatment is completed, condition is not the cancer, it is not malignant. And the visit is only to confirm the recovery. For example, follow-up after the pneumonia treatment, follow-up after the heel fracture, and follow-up after the infection treatment. So this is commonly used with the history codes Z86 and Z87, etc. So what are the simple real-life examples? Example 1. If a patient treated for breast cancer, treatment is completed and he comes for routine checkup. So which codes you have to assign? First, we have to assign Z08 for follow-up after the malignant neoplasm and Z85.3 for personal history of the breast cancer. And second example is patient treated for tuberculosis, which is fully cured, and follow-up visit only. So in this case, you have to assign Z09 and Z86.11, which is personal history of the tuberculosis. So follow-up codes Z08, Z09. So what it is emphasizing? So Z08 and Z09, they can also be used after any type of completed treatment, such as medical treatment, nothing but medications, chemotherapy, and also surgical treatment like operations and procedures. So as long as the treatment is fully completed and the visit is only for checking, so these codes can apply. Z08, follow-up after the completed treatment for malignant neoplasm. So this is used when the cancer treatment is finished and patient comes only for the routine examination and there is no active cancer is found. Whereas Z09 for completed treatment for non-malignant conditions. So this is used when condition is not cancer, whether it may be a pneumonia or any other disease, and the treatment is completed and the visit is only to confirm the recovery. So what are the examples? Follow-up after the treated infection and follow-up after the heel fracture, follow-up after the surgery with no complications. So this is a common additional code Z86, you have to assign Z86 for personal history of other diseases. Coming to Z39. So what is Z39? Encounter for maternal postpartum care and examination. So what is Z39? So this is used for routine care after the delivery when mother has delivered the baby and there is no complications are present. So visit is only for the postpartum checkup. And examples like post-delivery checkup visit, postpartum examination of mother. You should not use Z39 if complications exist. You have to use complication codes instead. Next is donor codes, category Z52. So what are donor Z codes? So these are used for living individuals who donate blood, organs, tissues. And these codes are for donor but not the recipient. So what are the important rules? What are the important guidelines for assigning the donor codes? So these are used for donating to others. These are used for self-donation. For example, patient stores own blood for future surgery. And these are not used for cadaver, that is dead body donors. So what are the examples of Z52 codes? Z52.0 for blood donor, Z52.4 for kidney donor, and Z52.9 for donor of unspecified organ or tissue. And next is counseling codes. So what are counseling Z codes? So these are used when patient or family member receives guidance, advice or emotional support. So guidance is related to illness, injury and family or social problems. So counseling is the main reason for the visit. Examples like genetic counseling, diet and nutrition counseling, family counseling after the serious illness and psychological support after the injury. So here are some counseling codes. So Z30.0. So this is used for general counseling and advice on contraception. Nothing but used when a patient comes for family planning advice or birth control methods discussion. Examples like counseling on oral contraceptive pills, advice on ICD or condoms, and there is no pregnancy or illness involved. Next is Z31.5, encounter for procreative genetic counseling. So this is used when counseling is given about the genetic risk before the pregnancy and inherited disorders. Examples like couple with family history of the genetic disease and counseling before the IVF, in vitro fertilization. So next is Z31.6, counseling and advice on procreation. So this is used for advice about getting pregnant, fertility planning. So what are the examples? Advice on timing, ovulation, pre-pregnancy planning, counseling. So Z32.2, encounter for childbirth instruction. So what is childbirth instruction? So this is used for education about labor and delivery. So what are the examples? Breathing techniques during the labor and birth preparation classes. So next is Z32.2. Z32.3, encounter for childcare instruction. So this is used for teaching parents how to care for a baby. Examples like breastfeeding education and newborn care training. Next is Z69, encounter for mental health services for victim and perpetrator of abuse. So this is used when counseling is provided for domestic abuse, sexual abuse and emotional abuse. So this applies to both victims and the perpetrators. So here the perpetrator is nothing but the person who causes the abuse. And next is Z70, counseling related to the sexual attitude, behavior and orientation. So this is used for counseling related to sexual behavior, sexual concerns and sexual orientation discussions. So this is used only when the counseling is a reason for the visit. And next coming to Z71, other counseling and medical advices. So this is used when counseling does not fit any other category. For example, lifestyle counseling, stress management advice, general health guidance. So counseling must be the main purpose of the visit. So there is no active disease should be treated. So this is a main key rule for the counseling codes. And next category is encounters for obstetrical and reproductive services. So what does this section mean? So these Z codes are used for routine pregnancy related visits when there are no complications and the pregnancy is normal. So if complication exists, you have to use obstetric chapter O00 to O9A codes instead. So when they use pregnancy Z codes, when there is a routine prenatal visit, when there is a routine postpartum checkup and no medical problems present. So you should not use this pregnancy Z codes if there is a gestational diabetes, if there is a hypertension and pregnancy complications. So codes in Z34. So what does Z34 mean? This is used when a pregnant woman comes for a routine prenatal visit and pregnancy is normal and there are no complications present. So what are the important rules for assigning Z34? So Z34 is always listed first. So do not use any obstetric complication codes with Z34. And what is example? If there is a routine antenatal checkup at 20 weeks, there is no problem. So you have to code Z34.82 for supervision of normal pregnancy, second trimester. And next is Z3A. So what is Z3A? What it is used for? So Z3A, the code gives additional information about how many weeks the pregnant the woman is. So Z3A codes are never used alone. So these are used always as a secondary code. For example, 28 weeks pregnant. So you have to code Z3A.28. So when not to use Z3A codes, so you should not assign Z3A if a pregnancy ended in abortion, 0O00 to O08. If the pregnancy ended in elective termination, Z33.2. If there are any postpartum conditions. So in case of inpatient, if hospital stay covers more than one gestational week, you have to use a week at the time of admission, but not at the time of discharge. So Z37 code, what is Z37? Outcome of delivery. So this Z37, it is used to describe how the delivery ended, whether it is a single live birth, whether they are twins, whether it is a stillbirth, etc. So what are the key rules over here? It must be reported on all the maternal delivery records. So always a secondary code. So it never used on the newborn records. It is only used upon maternal records. For example, there is a single live born baby. So you have to assign the code Z37.0. And Z37 codes, they are not for newborns. So never use Z37 on the baby chart. Always use only on the maternals or mother's record. So next is family planning and procreative management Z codes. So what does this guideline mean? Z codes are for contraception, family planning, fertility counseling. So they can be used during the pregnancy, after delivery, like postpartum. Examples like counseling for contraception after delivery, family planning advice during the prenatal visit. And here are some Z codes for obstetrical and reproductive services. So the Z codes, they are used when a patient is seen for family planning, pregnancy related care, delivery or postpartum services without treating a disease. And coming to Z30 category code, encounter for contraceptive management. So this is used for birth control advice or management, used for insertion, removal or check of the contraceptives. So examples of counseling of oral pills, IUCD insertion, contraceptive follow visit. And Z31 is about encounter for procreative management. So this is used when patient wants help with becoming pregnant. Examples like fertility counseling, IVF consultation and preconception planning. And next is Z32.2, encounter for childbirth instruction. And this is used for teaching about labor and delivery. Example like antenatal classes and breathing techniques during the labor. Z32.3, encounter for childcare instruction. This is used for teaching parents how to care for newborns like breastfeeding education or baby care training. And next is Z33, pregnant state. So this is used to indicate the patient is pregnant. So this code does not describe the care. It usually not coded with the obstetric care codes. And pregnancy noted during visit for another reason should be assigned the code Z33. And next is Z34, encounter for supervision of the normal pregnancy. So Z34, it is used when pregnancy is normal, there are no complications exist and it is a routine prenatal visit. So always it is a first listed code. You should not use with obstetric complication code. Z36, encounter for antenatal screening of mother. So this is used for routine pregnancy screening test. Examples like ultrasound, blood test and genetic screening. Next is Z3A, weeks of gestation. So this is used to show how many weeks pregnant the patient is. So Z3A, it is always used as a secondary code. And next is outcome of delivery, Z37. So this is used to describe the result of delivery, whether it's single live birth, whether they are twins, whether it's a stillbirth. And Z39, encounter for maternal postpartum care and examination. So this is used for routine checkup after delivery if there are no complications. And last is Z76.81 for accepted mother pre-birth pediatrician visit. So this Z76.81 code, it is used when pregnant woman meets pediatrician before the baby is born. For example, choosing a pediatrician and discussing newborn care. So this is about encounters for obstetrical and reproductive services codes. So next is 12th guideline, newborns and infants. So the Z codes are used when a baby or infant is seen for care, observation or routine checkups, not for treating a disease. So what is the important guideline over here? You have to always follow the ICD-10-CM section, IC16 for newborn or perinatal guidelines. So these rules explain how and when a newborn Z code should be used. And what is the important newborn Z codes? Z76.1, encounter for health supervision and care of foundling. So what does this mean? It is used whenever a newborn is abandoned or found and there are no parents or medical history is available. Example, a baby found in a public place and admitted for evaluation. So you have to assign Z76.1 code. So next important code is Z00.1, encounter for routine childbirth child health examination. So this is used for routine baby checkups, used for growth and development monitoring and immunization visits if there is no illness. Example, 1 month well baby visit with no problems. So you have to code Z00.121 or Z00.129 with or without abnormal findings. And also there is another code Z38, live-born infants according to the place of the birth and type of the delivery. So Z38 category, it is always used to show baby was born alive where the baby was born, either in hospital or home, whether the type of delivery is vaginal or C-section. So what are the important rules? This is used only on newborn records. Usually the first listed diagnosis used once at the birth. So example, baby born alive in hospital by vaginal delivery. So in this case, you have to assign the code Z38.00. So this is about newborn and infant guidelines. So next is routine and administrative examinations. So these Z codes, they are used when a patient comes for a checkup or examination, but not because of the illness. So what are the routine or administrative exams? So examples include general health checkup, school physical and pre-employment medical exam, and also insurance examination. Here in this case, the patient is not sick, but they all come under general health checkups. So when not to use these Z codes? So you should not use routine exam Z codes. If exam is done to diagnose a suspected disease, exam is done for treatment. So in these cases, you have to use the disease or condition code instead. So what if a problem is found during the routine exam? So if a condition is discovered, you have to code the routine exam Z code and you have to also add the diagnosis code additionally for the condition. So what if a problem is found during the routine exam? If a condition is discovered, you have to code the routine exam Z code. You have to also add the diagnosis code for the condition. For example, routine exam plus newly detected anemia. So what are the codes? You have to assign Z00.00 code for routine exam and you have to assign the 64.9 code for anemia. Pre-existing and chronic conditions. So what does it mean? If a patient already has a known condition, like diabetes, hypertension, and asthma. And the visit is only for a routine or administrative exam. So these conditions can be added as an additional codes. So what is an important condition? The exam must not be focused on treating than the disease. Example like pre-employment medical exam, patient has known hypertension but not treated during the visit. And the codes are Z0.00 for general medical exam and I-10 for hypertension as an additional code. So with versus without abnormal findings. So some routine exam Z codes clearly specify without abnormal findings, with abnormal findings. If without abnormal findings, patient looks normal. There are no problems detected during the exam. With abnormal findings, something abnormal is found during the exam. That abnormality must be coded separately. And always remember, coding depends upon the information available. So code assignment depends upon what the provider knows at the time of coding, not on future or pending test results. So coders cannot guess or assume results. For example, if there are pending test results, so scenario is there's a routine checkup done. There are no abnormal findings during the physical exam and the lab results not yet available. So you may code routine exam without abnormal finding. Later abnormal results. So coding is based upon current encounter information. So there is no need to change unless provided documents abnormality. So when using with abnormal findings, if abnormal findings are documented, so assign routine exam with abnormal findings. So also assign the additional diagnosis code to explain the abnormality. What may be the abnormality? What is the abnormality noted in the record? Example like routine exam plus high blood sugar detected. So what are the codes? Z00.01 for routine exam with abnormal findings as well as R37.09 for abnormal glucose. And next guideline is about pre-operative and pre-procedural examinations. So Z codes for pre-operative exams are used only when patient is being cleared for surgery or procedure. There is no treatment is given during the visit. So do not use if condition is treated or managed during the visit. So here are some Z categories for encounter for general examination. So Z00, general examination. So patient comes for a routine checkup with no complaints and no diagnosis. Example like annual physical examination, school health checkup, routine health screening. So patient feels fine. Doctor is just checking overall the health. Next is Z01, encounter for other special examination. So patient comes for a specific test or exam, but still there is no illness suspected or diagnosed. For example, eye examination, hearing test or pre-employment medical exam. So exam is focused on one purpose but not the general health. Z02, encounter for administrative examination. So examination done for official or legal reasons but not for the medical treatment. For example, like fitness certificate, medical exam for job, insurance, visa or sports, and also court-ordered medical exam. So what is the exception? Z02.9, encounter for administrative examinations unspecified. So this Z02.9, it is used when administrative exam is done and the exact reason is not documented. So always try to avoid unspecified if details are available. And Z32.0, encounter for pregnancy test. So patient visits only to confirm pregnancy in this case. So examples like urine pregnancy test and blood pregnancy test. So this code is used before the pregnancy is confirmed. So once pregnancy is confirmed, you have to assign the pregnancy Z codes, Z3A, Z34, etc. or use instead. This is about the encounter codes. And next coming to miscellaneous Z codes. So what does miscellaneous mean? So the Z codes, they do not fit into other main Z code groups. So they always describe special situations or special circumstances. So what are the important points about miscellaneous Z codes? So some codes explain why the patient came and other codes explain, they give extra information that affects the patient care. So examples of such situations are family history of the disease, genetic risk, lifestyle factors or past surgeries. So these codes support medical decision making even when there is no active disease. prophylactic organ removal. So what does prophylactic mean? So prophylactic means preventive. It means removing an organ before disease develops. It is done to reduce the future risk. So what are the examples? Preventive removal of breast due to strong family history of breast cancer, and preventive removal of ovaries due to genetic cancer risk. So what is the coding rule over here? For preventive, for prophylactic organ removal, the principal or the first listed diagnosis code must be from Z40 category, encounter for prophylactic surgery. So in this way, you have to assign the codes for miscellaneous Z codes and prophylactic organ removal. So this is for today's session. I hope the session has helped you. So in the next session, you will be learning about the continuation of Z codes, like the categories and the guidelines for miscellaneous Z codes. Thank you.